Okay, every clinician knows this feeling, right? You have a patient with severe health anxiety and they're completely stuck in this cycle of worry. And if we're being honest, we get stuck in a cycle of ordering tests and trying to reassure them. And at the end of the day, nobody's really getting any better. So today we're going to break down a really powerful evidence-based communication shift that can finally break that frustrating cycle.
You know, this quote from Dr. Helen Terrier just nails it. It perfectly captures that sense of exasperation. You're giving them clear, negative test results. You're telling them everything is fine, but that deep-seated fear it doesn't budge. And it was this exact problem that pushed Dr. Terrier toward a really profound insight into what's actually going on in these consultations.
So, to really understand the breakthrough here, we first need to get a clear picture of the problem, especially in its most challenging form. And that whole story starts with a patient who, for all intents and purposes, seemed completely unreachable.
Let's call this patient Isabel. For years, she was absolutely 100% convinced that she had multiple serious infections. I mean, every single test came back negative. Every specialist she saw found nothing wrong. But her conviction? It was just unshakable. And right there, that's the heart of the problem, isn't it? This total disconnect between medical reality and the patient's internal reality. And the thing that made this so tough was just the sheer volume of symptoms. It wasn't one single focused worry. It was a constant, relentless flood of bizarre and really alarming physical sensations. I mean, for any clinician, you look at this list and it's just overwhelming. It seems to have no logical basis, which is why we so often fall back on reassurance as our only tool.
So Dr. Terrier kept seeing Isabel, appointment after appointment, and she was just hitting a wall. She felt totally stuck. But then, a colleague gave her a piece of advice that completely flipped her perspective on its head, and it led to an incredible breakthrough.
And this gets to the million-dollar question, doesn't it? Why doesn't logic work? You show them the labs, you explain the science, so why do negative test results sometimes make the anxiety even worse? Well, the answer means we have to step out of our clinical shoes for a minute and try to see the world from their perspective. And here is the absolute key. From the patient's point of view, they know they're ill. The things they are feeling in their body are completely real to them. So, every single time a doctor says, "Don't worry, you're fine," it doesn't land as reassurance. It sounds like dismissal. It basically tells them, "I'm not listening to you," which forces them to double down and become even more obsessed with monitoring their own health.
And this brings us to the advice she got, which was so counterintuitive. She was told to stop trying to reassure Isabel and instead to just start writing everything down. Every single symptom, meticulously. Even the stuff that sounded completely bizarre. The goal wasn't about finding a diagnosis anymore. It was about demonstrating validation. It was about finally showing the patient, "I hear you, I am taking this seriously." So what happened? Honestly, the impact was immediate. It was profound. Isabel comes into the next appointment, sits down, and for the first time, she was quiet. She just waited. That relentless flood of symptoms, it had stopped. And why? Because her deepest need wasn't for another negative test. It was for her suffering to be seen and acknowledged. And once she felt heard, a totally different kind of conversation could finally begin. Now that one interaction with Isabel, that one shift in approach, wasn't just a one-off success. It actually became the foundation for a whole new way of communicating. It's a toolkit that any of us can use to totally transform these difficult consultations. Let's just break this down. The old approach, it's really a power struggle, isn't it? We insist, they resist. It's a dead end. But this new approach, it's all about collaboration. Instead of telling them they're wrong, you ask them what they think is wrong. Instead of ordering more tests to prove you're right, you ask what they are most worried about. It just completely shifts the dynamic from you being the authority to you being a partner. Okay, so what can you actually say? Here are the tools in their simplest form. 4 open-ended questions that completely reframe the conversation. They hand some of the control back to the patient. And they get you information not about a disease, but about the patient's deep-seated fears and beliefs. And that's the real starting point for any kind of effective intervention.